And welcome back. Well, women know that Kegel exercises are important to keep those pelvic muscles strong.
Because when those muscles are weak, it can lead to embarrassing problems like bladder leakage.
That's right.
Jamie Horndash is here from Skin Anti-Aging Lounge along with Mike DeVizio from BTL. It is the company behind this incredible solution to build up the pelvic floor. We've been teasing this chair all morning, Mike. We've been talking about how it's not your living room recliner because it does what? Something very special, right?
Yeah, so it uses electromagnetic energy to induce 11,000 Kegel contractions in a 28-minute session. So we're improving continence in both men and women.
11,000?
So you say Kegel, by the way, not Kegel.
Yeah, it is
proper?
Kegel. It's actually Kegel.
Oh, okay, I didn't know. I was like, wait, which one's which? I don't know. Tomato, tomato, right?
So you said 11,000 Kegels in a 28-minute stretch of time.
Absolutely.
That's incredible. Something that would be hard for us to do on our own.
Right. It's almost impossible as humans to do that on our own.
I've only done 5,000 since we started.
More on that later.
But this is truly incredible, and it helps people with a problem that they oftentimes are just living with and is affecting the way that they go about their everyday life, right?
Right, right. So a lot of women, suffer from these symptoms after childbirth, and they just assume they have to live with that condition. And this is really the first truly non-invasive treatment that can help them.
Yeah.
Okay, so we've been laughing a little bit about the chair. It's a serious thing because people who deal with this on a daily basis, it might be coughing or exercise, but it might be even more often than just exercising and things like that. And to think that there's a solution for it, I bet people that you see in your office, it's a hard thing to talk about.
Well, and not only that, this is ageless. And again, it's 18 and up. But you think about athletes, and it's not just stress incontinence. Incontinence is kind of across the board with, everywhere from, laughing and having to do that little leg cross.
Yeah.
And nobody likes the word stress incontinence. There's such a taboo with it, but it's a varying condition with, again, the loosening of the pelvic floor. And this does it. After I did my first session in 10 minutes, I realized this is how you do a Kegel, and this is what a Kegel feels like.
So you can feel it?
Oh, absolutely.
Really?
Oh, absolutely.
And it doesn't hurt?
There's no pain whatsoever. There's no downtime with this either.
Well, the other thing to point out is you're sitting on a flat surface. This is not like anything, like you said, that's invasive or inserted. This is truly a flat chair that you're sitting on.
You sit on this fully clothed. The only thing that we don't want you to have is a metal, any metal zippers or buttons.
Okay.
Are there some people who wouldn't be a good candidate for this?
Yeah, so we don't want to treat anyone who's currently pregnant. We don't want to treat anyone. It's magnetic, so any metal, if it reacts with metal, that metal will heat up on them. So we want to make sure that we're not treating anyone who has metal implanted inside of their body. That includes a copper IUD. That includes piercings of any sort, clips from a previous surgery. So those are the two things, pregnancy and that we really want to stay away from.
Okay, so how many sessions do you need? Say you're a good candidate, you've been living with this, and you're ready to make a change. What type of treatment plan does someone expect?
So it's 6 sessions, and we do it twice a week.
And how long are the sessions?
28 minutes.
So in that time, you're getting all of those Kegels, like you said.
So in 3 weeks, basically. And are people experiencing rather long-term benefit? And I wonder what exactly are the benefits?
Oh my gosh, the benefits again go from when you're strengthening that pelvic floor and the pelvic muscles, that also helps strengthen and support the bladder. It also has some great side effects for sexual wellness. Again, with, and again off-label, but we're seeing lubrication and sensation.
Yeah.
Wow.
And I think in general, when you've seen people, how long have you had this, by the way?
Oh.
Gosh, you guys have had it for about 8 months now.
About 8 months.
Okay. Yeah.
What kinds of things have you heard people say after they've had their treatments? Because obviously these are the things that we know the benefits that it can cause, but what have you heard patients tell you?
We've had a lot of our patients say even after their first treatment, they've noticed a difference. Again, for our menopausal gals getting up 4 or 5 times a night, they're noticing a great decrease in the times that they have to get up. And again,
to go to the bathroom.
Right, and it sounds odd, but being able to stop a stream, having the strength to stop that.
Yeah.
And again, that's, with strengthening that pelvic muscle, That's key.
I think this is really exciting too, Mike, for people who maybe have a hard time talking about it. If it's something that you can share and something that you're open to doing, you think about the life benefits of this. I think it must feel very good to all of you involved in providing this type of service to think about what it's doing to change people's lives.
Oh, absolutely. And you don't have to have UI symptoms to be a good candidate for the Emsella chair. For anyone who's out there doing their Kegel regimen, or anyone who has trouble doing their Kegels, they're also a great candidate for this, because while you're healthy, before you have any of those symptoms, it's great to just keep that pelvic floor strengthened, just like the rest of the muscles in your body.
Absolutely.